hospitals. The next president will have to take on the special interests that thrive in the healthcare system. Doctors must do a better job of managing our care and keeping us healthy and out of hospitals and nursing homes. We'll need alternatives to doctors' offices and emergency rooms. Hospitals must do a better job of taking care of us when we're there, commit far fewer deadly and costly medical errors, and generally operate more efficiently. Pharmaceutical companies must worry less about squeezing additional profits from an old medicines by copying the last successful drug and insisting on additional patent protection, and focus more on new and innovative medicine. Insurance companies should spend more on medical care and less on administration. My reforms are built on the pursuit of three goals: paying only for quality medical care, having insurance choices that are diverse and responsive to individual needs, and restoring our sense of personal responsibility. These reforms are also built on the most fundamental of medical tenets: do no harm. There's much to be admired about medicine in America, and I want to protect those qualities. Doctors and other providers want to provide quality care. Lower costs mean that Medicare premiums don't continue to spiral beyond our ability to sustain it, and our insurance premiums are stretched further. Most importantly, any reform must respect the freedom to keep your care and insurance just as they are. The first principle of real reform is that Americans should pay only for quality. Right now, too much of the system is built on getting paid just for providing services, regardless of whether those services are necessary or produce quality care and outcomes. American families should only pay for getting the right care that is intended to improve their health. American families know quality when they see it, so their doctors should be in their hands. When families are informed about medical choices, they are more capable of making their own decisions, less likely to choose the most expensive and often unnecessary options, and are more satisfied with their choices. Health savings accounts are tax-preferred accounts used to pay insurance premiums and other health costs. They put the family in charge of what they pay for and should be expanded and encouraged. I'm committed to ensuring the finest quality medical care for our veterans. They've earned that consideration and more. They should not have to wait for access to a VA facility that is hours away. We can't give them the option to put the means for financing their care under their control. And we should give them an electronic card or other device so that if they want, they can choose their care in another way that suits them best. We can't let the search for high-quality care be derailed by frivolous lawsuits and excessive damage awards. We must pass medical liability reform, and those reforms should eliminate lawsuits for doctors that follow clinical guidelines and adhere to patient safety protocols. If the Democrats are sincere in their conviction that health care coverage and quality is their first priority, then they'll put the needs of patients before the demands of trial lawyers. But they can't have it both ways. Research shows that coordinated care, providers collaborating to produce the best health outcome, offers better quality and costs less. We should pay a single bill for high-quality health care, not an endless series of bills for pre-surgical tests, visits, hospitalization and surgery, follow-up tests, drugs, and office visits. Paying for coordinated care means that every single provider is now united on being responsive to the needs of a single person, the patient. Health information technology will flourish because the market will demand it. Clinics, hospitals, doctors, and medical technology producers, drug companies, and every other provider of health care must be accountable and their transactions transparent. Families, insurance companies, the government, whoever is paying the bill must understand exactly what their care costs and the outcome they received. Families place a high value on quickly getting simple care and have shown a willingness to pay cash to get it. If walk-in clinics and retail outlets are the most convenient, cost-effective way for families to safely meet simple needs, why should government stand in the way? I will not. If the cheapest way to get high-quality care is to use advances in web technology to allow a doctor to practice across state lines, then let them. In disasters like Katrina, we saw how stupid and harmful it is to refuse the services of doctors just because they had an out-of-state address. We should have a national marketplace, and if I'm elected president, we will. Drugs, as you know, are an important part of medicine and are often quite expensive. Here in Iowa, the Attorney General is suing 78 drug companies, accusing them of inflating drug costs paid by Iowa taxpayers through the Medicaid system. Problems with costs are created when market forces are replaced by government-regulated prices. If drug costs reflect value, that's fine. But there are ways to bring greater competition to our drug markets by safe reimportation of drugs, by faster introduction of generic drugs, or by any other means we should do so. If I'm elected president, we will. Government programs such as Medicare and Medicaid should lead the way in health reforms that improve quality and lower costs. Like most of our system, Medicare reimbursement now rewards institutions and clinicians who provide more and more complex services. We need to change the way providers are paid to focus their attention more on chronic disease and managing the treatment. This is the most important care and expense for an aging population. And in a system that rewards quality, Medicare should not pay for preventable medical errors. I'm appreciative of the therapeutic benefits of modern pharmaceuticals. However, I am strongly opposed to adding another unfunded entitlement to the physical train wreck that is Medicare by providing all seniors with a costly drug benefit, even those like me who can more than afford to pay for their medicine. After all, we vote ourselves a sufficient number of pay raises to take care of that. The second principle of effective reform is to have insurance choices so varied and responsive to individual needs that you could fire your own insurance company if you wanted to. Right now, too many of our citizens don't have an insurance policy at all. And those who do are afraid they will lose the one they have, afraid they will get too sick, afraid to stay home and not work full time, and afraid their benefits will disappear along with their job. I believe that everyone should get a tax credit of $2,500, $5,000 for families if they have health insurance. It is a good tax policy to take away the bias toward giving workers benefits instead of wages. It's good health policy to reward having insurance no matter where your policy comes from. To use their money effectively, Americans need more choices. We should give additional help to those who face particularly expensive care. If it's done right and the additional money is there, insurance companies will compete for those patients, not turn them away. It's a challenge to develop techniques that allocate the right amount to each of these families. I propose that we try a time-honored approach and let the states work on whatever method they find most promising. The federal government can help fund this efforts, but in exchange, states should allow Medicaid and S-CHIP funds to be used for private insurance and develop methods to augment Medicaid and tax credits for more expensive care. Family-based policies translate into broad success when they are paired with greater competition among insurers on a level playing field. You should be able to buy your insurance from any willing provider. The state bureaucracies are no better than national ones. Nationwide insurance markets that ensure broad and vigorous competition will wring out excessive costs, overhead, and bloated executive compensation. Introducing competition into the health insurance market will reduce costs. Some are already content with the choices and advice offered by their employer. Fine. But Americans should be able to choose who they trust. If a church or a professional organization wishes to sponsor insurance for its members, they should be able to do so.